meeting of the Burlington Board of Health to order. Please join me for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. I'm Dr. Ed Weiner, Chairman, and with me this evening, Board of Health members. First, our Vice Chair, Dr. David McSweeney, Andrea Sheehan, Gail Demore, and Mary Beth Welch could not be with us tonight. Also with us is Susan Luminello, Director of Public Health, Michael Green, Associate Director of Public Health, Christine Mathis, Environmental Engineer, and Marlene Johnson, who is our health agent. Also with us this evening is Recording Secretary Eric Bergeron. Please note we are live on BCAT and available for appropriate comments and questions through this video technology. And thank you, BCAT, for all you do to keep us community well informed. We have approval of minutes for May 24th, 2022.
A motion to approve, Mr. Chair.
I have a motion to approve.
Second.
And I have a second from Andrew Sheehan. All in favor?
Aye.
I also have minutes from the July 6th Board of Health Smoking Regulations Subcommittee, and I'd like to put that off, please, until we bring up that subject. Would that be all right? Oh, it brings me to Chairman's report. Well, yeah, Jim, then we'll do citizen times. Well, it's been a real hot and for many a difficult summer, especially with the new and highly contagious COVID-19 Omicron variant BA.5. Thus, I hope you and your family are safe and well. The Board of Health has been extremely busy. First, exciting news. We have received a large grant. We will coordinate and administrate a 3-year, almost 7-figure program with sister towns Wilmington and Lexington to provide additional public health programming to the region. In addition, planning for our public health faculty program has begun. I hope that we will have it listed and an available group for clinical, scientific, and public health speakers that will be able to speak at schools, organizations, religious groups this year, or at least the beginning of next year. And we hope to have a new supervisory public health nurse on board to seamlessly replace our outstanding Christine Pollock, who'll be retiring in September. And now this. I've been getting lots of questions and so many comments because multiple news outlets have reported that biotech laboratory or laboratories will soon replace retail space within our Burlington Mall. Well, let me set the rumor straight. This is not true. The mall is not zoned for biotech, and any zoning would need to be handled and approved by town meeting. 3, the Board of Health would require major hazardous material and biotech oversight. Now, biotech is the future of our country. It's the future of our Commonwealth. It's the future of our community. And it's highly safe and a regulated industry. Even so, tonight, I will appoint a subcommittee made up of myself and our vice chair and professional staff to review our current Burlington biotechnology regulation, and if necessary, make even further changes, strengthening our biotech oversight to ensure our town will be fully and forever unquestionably safe. And you can feel free to call me with your comments. A number of people have. As always, we are here to discuss any questions that you may have Our website is a great resource, accessible to everyone, anytime, and most important, as you know, we are always just a phone call away. So thank you very much. As I say, any comments or anything that our other members would like to say? Good. Citizens' time. Is there anybody here or online who does not have an agenda item that they are here for that would like to speak to the board? I know that that individual here is for one of the agenda items. Is there anybody online?
So we have Attorney Cheryl Sabara here. She's for the discussion on the regulations. Greg Cohen, I'm not sure if he's here for Northeastern or not.
Is he?
Okay.
Okay.
Thank you.
Thanks.
Since I expect our Burlington Board of Health regulations restricting the sale of tobacco products and revising the Burlington Board of Health regulations prohibiting smoking in workplaces and public places to take a little bit of time, I would like a motion to take Northeastern University, 147 South Bedford Street, update on structural integrity of abandoned bunkers report first.
I'll motion that.
I have a motion by Andrea, second by Gail. All in favor?
Aye.
Opposed? 4-0. So let's talk about Northeastern University. Who is going to lead this discussion?
I can.
Our environmental engineer, please.
Sure, let me provide a little bit of background on the project regarding the bunkers that are in place at Northeastern. Northeastern, as you know, has a campus located at 141 to 147 South Bedford Street. And it's been, it's an educational facility. It was formerly a Nike missile launch site back in the late 50s to the early 60s. And as such, there are two missile silos or bunkers embedded underneath the parking lot of the existing facility. When Northeastern came before the town for a special permit and a site plan approval to install the now existing Building 5 or ICBM building, the Board of Health placed a few requirements on that project, one of which was the board asked for a engineering analysis and opinion regarding the structural integrity of each silo or / bunker to be conducted by a Massachusetts licensed structural engineer. That analysis was done by a licensed engineer. The analysis concluded that the existing concrete roof structures on the two bunkers were not of adequate capacity to support what is already in place above them, and additional weight from heavy equipment such as fire trucks or construction vehicles. As a result, Northeastern placed agreed to restrictions on the use of the space above the silos, one of which was that they would barricade off the silo that happens to be in the middle of the parking lot, restricting access to any parking above it or driving across it. The second of which was that they would establish a lawned entrance area to the new building above the other silo with barriers to prevent vehicles from driving up onto that lawn. The other piece of that was the recommended report, the structural engineering report recommended periodic review of the structural integrity. The two restrictions for vehicular traffic and parking above both silos have been met, as I just described. And like I said, the initial structural engineering report was done. However, the updated report was due last June, and they are late on that. So that's why they're here tonight, to give us an update on the status of when to expect that.
When you said June, is that June 2021?
Yes,
So it's been over a year.
yes.
Okay, thank you. Susan, would you like to make note? You gave a little history, some of the history that we've been dealing with these silos now for more than 20 years. I've been on this board a long time, more than 20 years, when we had the Army Corps of engineers here to deactivate them and take out the equipment that was sitting in them, rusting away, and they weren't in good shape then. And when Northeastern University decided to make those changes, we were nervous about those silos then. And rather than ask them to fill them with sand, which would have been years to do because they're so large, we just asked them to take a look at them every 2 years, just to make sure that our trucks, our cars, and the students that come to Burlington would not fall through the driveway. And that's all we asked. We agreed upon at the time, I'm not sure if you were here, we agreed upon the time that every couple of years to have someone just go down and take a look. Well, it's been 3 years now since someone took a look, and it makes me nervous that something's going to happen there. We see these sinkholes taking place everywhere, and so we're following through. Please, would you like to speak?
Sure, come on up.
Come up, why don't you come up to and please identify yourself and sign in.
Get right over here.
You're on cable TV.
Yep, my name is Paul McAndrew. I'm a senior project manager.
Could you
Sorry.
please sign in and
Yeah.
printing your name, please, because
now?
for our recording secretary.
Sure.
We want to make sure that our excellent Derek can read your writing.
Okay,
Please.
thank you very much. So my name is Paul McAndrew. I'm a senior project manager with the Office of Campus Planning, Real Estate, and Facilities at Northeastern University. I was actually the project manager for Building 5 in Burlington. The project was led by me, but there was a larger team, obviously. The owner's project manager no longer works for the company, for Answer, so he wasn't able to be with us tonight. But I do have a structural engineer, Greg Cohen, who actually led the investigation in 2019 for the bunkers. So I first want to say that Northeastern apologizes for this. We're typically timely. Any excuse I say right now feels like an excuse, but I have to say that COVID definitely affected things, as did a pretty major turnover at Northeastern. We had several folks in senior level positions and facilities that have left within the last 12 to 24 months. So if anything happened, some of the conditions kind of fell through the cracks. So we're here tonight to let you know that we're on top of things again, that we are going to be moving forward with an investigation as soon as we possibly can. And I'm hopeful that it's going to happen before fall, before September 1. We have a proposal from Greg's company to actually revisit the bunkers and do a structural investigation. We have a proposal from a consultant to Greg to assist in that. We're putting the costs together that are associated with a contractor pulling the manhole covers, as well as a safety rescue team that has to be on site because of confined space.
Thank you.
Thank you.
I don't know how the board feels, but can we have an agreement with you that it'll be done by October 1st?
Yes, you can. I unfortunately don't work for the portion of Northeastern. I'm part of a large team, but the contact information that I gave to Christine and to Susan is for the AVP of facilities, who unfortunately is out of the country currently. He should be back in about a week. He's the one that's going to be able to answer everything from covering the cost of the project to future maintenance. I would like to say yes. We've made significant headway since we were contacted by the Board of Health, and I feel that it's something that an investigation could actually begin the next month or so if everything aligns.
Mr. Chair?
Yes.
Thanks for coming in, Mr. McAndrews. I appreciate it. I was on the board when we approved Building 5. Northeastern has always been a really good community organization. We love having you here. So this is not personal by any just of the imagination. But we were very concerned about the bunkers. And now I'm getting even more increasingly concerned because of the structural integrity seems to be worsening. So when you say that you're doing an investigation of the bunkers, what does that entail? Is it just more about cordoning it off, or are you talking about removing the bunkers?
No, so as Christine mentioned, we did cordon off the bunkers. So there's one that's actually in a mound, covered under a mound of earth.
Right.
That the structural engineer analyzed and said that it could take that load. It's only several inches. It's really nothing more than to plant grass. The other one in the parking lot is cordoned off by Jersey barriers, so vehicles cannot possibly drive on top of the bunker that's in the parking lot. The investigation that we did 2 years ago entailed pumping a large amount of groundwater out of each bunker.
Yep.
I'm hopeful with the current weather. I mean, it's a bad thing for the grass out there right now and the environment, but I'm hopeful with the current conditions that the water level would be very low within the bunker, which would obviously help us kind of get into the bunker and to investigate further. The investigation focuses on the structural integrity of the ceiling or the roof structure of the bunker. So it's that surface where the beams in the concrete deck span approximately 60 feet.
Yeah, I guess my point is I'm not, and I think the permanent solution necessarily isn't just living with the cordoning it off, because it seems like it's deteriorating pretty rapidly, particularly with the new pavement over that one piece. I don't know how the structures of the other one. So, I concur with the chair that, it's already a year late. I think October is a good timeline for us. And I know you don't necessarily control that because it's a big organization, but I think that's a pretty fair, considering you're already a year late, that's a pretty fair timeline.
I would agree with you, yes.
Okay. Anybody else would like to speak? Gail or Andrea? Anything, any of our professional staffs? Well, let me put that to a vote. I guess that would say I'd entertain a motion would it be a request or would it be an order?
Do you want to, so if we don't get the report by the first meeting in October, do you want to have them come back to that meeting?
Yeah, I think that's a,
Okay, so please move that we,
so should we continue?
And then
Can we continue this to the October 1st meeting?
You
or-
could do that, yeah, continue it unless in the event that we get the report, and then when
Ahead
we
of
get the
time, you mean?
report,
Yeah.
and everything's fine, then they wouldn't have to come.
okay,
Is that-
all right. So I move to continue this till the first meeting in October, would that be
So,
all right?
yeah, should we vote on that?
Yeah, I think we need, I'm sorry?
I was gonna say, is there a chance that we could be notified in September that it looks like they'll make the October date, or if it's gonna slip, can we be notified?
It sounds like the report's gonna be ready in a month.
If that's the case, then we just.
Well, then, we'll get it earlier. They're not gonna hold it till
I don't
October
think we
1st.
should wait till October 1st unless you think that's unreasonable.
They haven't even
October 1st
started
is
it
tight.
yet, yeah.
It's tight.
It's real tight. They have to make physical entry into these giant bunkers, which requires a lot of engineering effort, a lot of health and safety oversight, because it is a confined space entry,
Coordinating of it, okay.
and getting,
You have to have an emergency crew on board.
yeah,
Okay.
and getting testing done, correct? Code updated on the testing.
It's more of a visual or sounding
Okay,
test,
yeah.
and yes.
So, Mr. Chair, I'm comfortable with moving with continuing the discussion for Northeastern until the October, first, you don't know what the date is, do you? The first meeting in October.
Right, okay, so
If not before, if the,
If it's ready.
At the
Reference,
latest,
right.
yeah.
I have a motion by Mr. McSweeney, second by
Second.
Andrea Sheehan.
Yeah, just to clarify that though, if we get the report, they won't be coming back because we have already.
Yeah,
had
that's
that.
fine, yeah.
Okay.
Okay.
Yeah.
Oh, we put it on the agenda and just announce to the public that we don't need to meet.
Right.
That's taken care of. in your career did you expect that you'd be spending all kinds of time evaluating missile bunkers?
No, I did not. There's always a first for something, though.
I have
Exciting.
a motion, any other discussion? All in favor?
Aye.
4-0-0. Thank you very much for coming.
Thank you very much. Thank you.
Mr. Cohen, did he have anything he wanted to say? I should have asked.
I was listening intently, and I agree with what Paul says. We're prepared to move as quickly as Northeastern can cut us loose to do the inspection and develop a report to share with you.
Thank you so much.
Okay.
Good night, everybody. Thank you.
Thank
very
you.
much.
Thank you.
Thank you.
Thanks for coming in.
Okay, we're going to go back to our agenda, and it will be discussion, no, it will be the hearing. Revised Burlington Board of Health regulation restricting the sale of tobacco products. And I'm going to put them together. Revised Burlington Board of Health regulations prohibiting smoking in workplaces and public places. And I think that our Director of Public Health is going to be presenting that to us.
Yes. So I have a presentation that, to put up, just a short number of slides. But I'm also going to be discussing the red line version of the regulations, which is included in your backup material. Okay, so 1 second here.
Mr. Chair, if I could just mention as well, we did have a subcommittee meeting, and this is the output of that subcommittee meeting.
Okay.
In addition to the second part of that was about smoking in workplace and public spaces, was because the subcommittee felt like further discussion was needed on that.
Good, okay, I understand, thank
Okay,
you.
You're welcome.
So thank you for that. Is that considered the report, correct?
Yeah, I guess we can use that as the subcommittee report.
Okay. So the proposal is to adopt the new regulations restricting the sale of tobacco and vape products and rescind the current regulations. The proposed regulations are based on sample regulations, which incorporate the current state regulations into local regulations, and that's in attachment 1 in your board book materials. As you know, local regulations can be stricter than state regulations, but not less strict. Therefore, the amendments to both.
It's really nice to see you guys.
I'm just gonna put.
My,
Can I help you?
Therefore, do you want me to, I just muted him.
my name is Mosquito, or what is your name, sir?
And why are you here?
To learn about tobacco and how health can improve your learn about safety and health relations.
Good, thank you so for coming. Thank you, we appreciate it. Thank you.
So, therefore, that's why the amendments are necessary. The yellow highlighted areas in attachment 1 are from the current DPH regulations and can't be changed. And the green highlighted sections can be changed at the local level. So the subcommittee met on July 6th and recommended portions of the green changes which can be amended. So the next one. So the amendments that are occurring that are happening because they need to be consistent with the state regulations, I'm not going to go through all of them. You can see in the red line version all of them. I'm just going to highlight the most significant ones, which we discussed at the subcommittee meeting as well. It's sections 3 and section 8. So if you look at section 3, this is the definition section. And it adds a definition of a flavored tobacco product and a tobacco product flavor enhancer. And this ties in as well with section 8. And this prohibits the sale of any tobacco flavored product or any tobacco flavored enhancer. Section 14 is the violations. It separates the violations into 2 categories for penalties. So there's violations that exist now in these proposed regulations for state regulations and violations of local regulations. And it lists specifically which ones are state and which ones are local. And the fine structure is different for depending upon whether it's state or whether it's local. So if it's a if it's a violation of a state regulation, the fines have now been raised from $100 to $1,000 and a permit suspension for 3 days. So that's automatic, $1,000 and permit suspension for 3 days. For a second violation, it goes from 200 to 2,000 and permit suspension of 7 business days. And for third violation, raises from 300 to 5,000 and permit suspension of 30 consecutive business days. For violations under the local regulations, it keeps the fines and permit suspension periods the same as what is currently in our regulations. Okay. It also, section 14.3, allows for permanent revocation of a tobacco sales permit in the case of 4 violations or repeated egregious violations within a 36-month period. So that would be either, it can be combined, it can be a state violation or a local violation. Any 4 of those types of violations within the 36-month period would allow the board to permanently revoke the permit.
Can I have a question with that, please?
Yep.
Or would you rather
And
wait till the end?
Cheryl Sabari is here as well, so she can answer any legal questions too.
If there is a tobacco, I guess they call it sting, and it's a state violation,
So if sales to someone under the age of 21 is a state violation, it would
and
be
we're bound by those penalties, correct? Now, can they appeal, do they appear before this board, or is it automatic?
So they would appear before this board for a hearing, because they're allowed the hearing.
Yes.
But the only question that would be posed to this board, and this is what I learned from Cheryl Sabara, is that was the sale made or not? Not that, my salesperson, is a different salesperson, or somebody was filling in, or something like that. The board cannot use that as a way to kind of say you don't need to pay the
We
fine.
can't subjectively
The
put in
only
leniency.
question is, did they sell to someone under the age of 21?
Okay,
Okay.
thank you.
All right, so for local Board of Health decisions, and this is what was discussed at the subcommittee meeting. The first one is section 3.0, the definition of a cigar. So it adds tobacco leaf in such kits or roll your own packages shall be considered blunt wraps for the purpose of this regulation. So if you add that sentence to the definition of cigar, this would then prohibit the sale of these tobacco leaf kits. The subcommittee recommended to keep this in. Okay. The next one is section 3.0, the definition of a tobacco flavored product. You can add to the definition, a rolling paper with a characterizing flavor shall be considered a tobacco product flavor enhancer. So this would prohibit the sale of flavored rolling papers. They can still sell rolling papers, they just can't sell flavored rolling papers. And the subcommittee recommendation on that was to keep that in and to ban the flavored rolling papers. The next is section 5.8. It mandates that a permit will not be renewed if sales to a person under the age of 21 has occurred 3 times within the previous permit year and the time period to appeal has expired. The subcommittee recommendation was to keep that in. Section 8.0, the sale of flavored tobacco products, to add the wording to possess, hold, or keep. So it's that you can keep that wording in or leave it out in regards to a tobacco flavored product or tobacco flavored product enhancer. This means that any product would have to be completely removed from the establishment. So if we go in and we do an inspection and they have a flavored tobacco product, and we say, you can't either, if you keep it in, they can't even keep it in the store. They can't say, okay, I'm gonna take it off the shelf and I'm gonna put it in the back room. They can't do that. They would have to remove it completely from the store because they cannot possess, hold, or keep it. The subcommittee recommendation was to keep that in. And then section 14.0 for the violation. The Board of Health can increase the time frame for suspensions and increase the fines. And the subcommittee recommendation on that was to keep as is. And then also, which is not in your copy, in section 14.1A, there is some typos there. So one of them, it's 1A, it refers to 105 CMR, it says 040. This actually should say 665.040D. And it says for 3 business days, that should say for 3 consecutive business days. So those changes are also part of this. Any questions?
Well, first, I want to thank the subcommittee. I know it was a lot of work. I know that Mary Beth Welch is not here this evening. She was on the subcommittee.
No, Gail.
Gail, thank you.
Moved in, yeah.
You moved, thank you so much. I wasn't sure, maybe.
Taking over slowly.
So that's good. Thank you so much. I know it was a lot of work, a lot of pages to review. I read this and I had to go back and forth and back and forth, and it was a lot of work here. So thank you very much. Thank you.
Sure.
Thank you. Do you have any other comments for you? If not, I'd like to ask our attorney here. Thank you very much for coming. And any comments?
I would just say
I have one.
Oh, well, why don't you hold on, please? We're speaking to our attorney first, and then you're welcome to ask the question. So just hold your question, please. Please, Mr. Rao.
Hi, thanks very much for holding this hearing. My name is Cheryl Sabara, and as Susan said, I am the Executive Director and Senior Staff Attorney for the Massachusetts Association of Health Boards. And we provide technical assistance and legal education to the 351 boards of health in Massachusetts. And I first want to really commend your health director for putting together such a streamlined yet comprehensive presentation of what the changes, the significant changes actually would be to this regulation should you decide to vote them in. And the rationale behind a lot of the changes is to comply with the state law, which you have to comply with in any event, but this just brings your local regulation into compliance with the state law so that it's easier for the retailers to understand and easier for staff to enforce. And I also commend the director in explaining the differences between what you have in your local regulation that does not exist in the state law. And that would be the cigar pieces, the blunt wrap pieces, some of the permit issues. Those are not addressed in the state law. So you have the legal authority to set the fees for those. Some of the questions that were asked, I believe, by the chair were very relevant and, in my opinion, important, because now that the fines are so high for the state law provisions, we've had to come up with a different enforcement strategy. We can't use non-criminal disposition because the fines are so high. Non-criminal disposition only goes up to $300. So we've drafted a cease and desist correction order based upon the Department of Public Health regulations and the state law. And that template lays out for the retailer their right to a hearing, their right to appeal. It really lays out what happens when the law is allegedly violated. So I think, and obviously I don't represent the town of Burlington. I just provide legal education and technical assistance. Your municipal attorney represents the town, but I can tell you that this is happening in many of your sister municipalities are looking at their regulations and amending them so that they also comply with the state law. And I'm happy to answer any specific questions that Susan didn't already address, if there are any that she did not already address.
I have one question. Have
Sure.
the institutions, and maybe you don't know, it's not your purview, around the state, do they know that the state regulations have changed? Have
Yes.
they all been notified?
Yes. In fact, this was what happened. The law, the comprehensive law, including the combustible tobacco product provisions, went into effect in June, the beginning of June of 2021, which is obviously during the pandemic. And there were not a lot of inspections, in-person inspections happening. So this was a time where a lot of health departments and tobacco control programs were reaching out to retailers to let them know about these changes to the law. So the retailers have been well aware that the state law is in existence, and they have been for well over a year now.
Thank you very much for coming, and thank you very much for your help. And
Sure.
it's great to know that you're there for advice and for mentoring us. So thank you.
Absolutely.
I have no other questions. If we could go ahead and we could the vote to revise these separately.
Yes, and I'm hoping Cheryl will stay for the, smoking in the work.
Before we
Yeah,
do
we
that,
have
we have
somebody
somebody.
online. What is your name, please?
My name is Manu, and my question, I live in Alexandria, and my question is, health can be like a fitness goal, or how health can help nutrition, what you eat and what you cannot eat. And to, having too much tobacco is not really safe or good for you. And tobacco can hurt your immune system. And a lot of my friends, one, he smokes, and don't I don't smoke because smoking is not good for your body.
Thank you. What I suggest is you call the Board of Health. You live in Burlington, that you call the Board of Health and you speak to our Board of Health supervisory nurse. And if you have specific questions, you can ask her. If you have specific questions, I'll ask the Director of Public Health to answer any questions. Or if you'd like, the Director of Public Health will provide you my phone number, and I'd be very happy to speak with you. So I want to thank you for getting on. It's great to see someone who is so interested in smoking regulations, and we thank you very much. And please take advantage. I'd love to speak to you if you'd like to call me. Thank you.
Okay, thank you.
Thank you. So, Susan, we go ahead and we move to revise the Burlington Board of Health regulations restricting the
Sale
sale
of tobacco products as indicated in your presentation. Would that do it, or would we have to read them all off again?
No, you don't have to read them all off.
So that would be the first
Going to
motion,
work.
if someone would make that. Maybe someone from the, that motion was made by Ms. Demore, and the second by
Second.
the other subcommittee member, Vice Chair McSweeney. Are there any other comments, questions, anything else? If not, all in favor? Aye. 400. And then the next one would be revised Burlington Board of Health Regulations.
May I just interrupt for 1 minute?
Sure.
Could you also pick an effective date?
Pick an effective date. Is upon publication, okay, Cheryl, or do we need, I thought usually we do them up.
Usually, well, I think it is fine in this case because what you're doing is just complying with the state law. So effective upon publication is fine.
So is there a notification?
So we are required to publish it.
Right.
In its
When
entirety,
you say
correct?
publish it,
In
what is-
a legal ad. The notification to the retailers, you mean? We did let them all know of this hearing in case they wanted to come. I did answer questions from one establishment, and he felt like he didn't need to come.
And I did today as well. Somebody
Okay.
called me today.
So I'm going to then do the next one, and then we'll do a third motion that the other two upon publication. Or we have to go back to the.
Or you could choose an effective date. If you wanted to choose effective date tomorrow, they could do that as well, right, Cheryl?
Yes.
Yeah.
So let me just do the second one, and then we'll move to do an effective date on the previous two upon publication, all right? Rather than go back and have to vote again.
We
on
have two motions out there, so you would have to,
Yeah, you see what I mean? Do we have to go back?
yeah, we'd have to go back and revise the
Revise the first.
first motion.
Yeah, who made the motion?
Gail.
I did.
So we
I thought
revise it
I was
with an
supposed
effective, yeah, you will.
Okay.
So just say I want to modify my motion
Oh, I'll modify my motion to be effective when this second.
upon publication.
Upon publication. In second.
second.
And we'll vote again. All in favor? Aye. Now, the second would be revised Burlington Board of Health regulations prohibiting smoking in workplaces and public places.
Well, we have to discuss that one.
Yes, we have to
Yeah.
discuss that one. Is there any discussion on that?
Well,
So-
I have an overview of
Yeah,
that.
that'd be great. So,
Yeah.
Mr. Chair, again, this is, we did review this during the subcommittee,
Yes.
as I mentioned prior. And we felt that there was more discussion needed on this, that we were on the fence. There was, a lot of information that could, we could be comfortable with the way it is, or we might want to change some things, but we felt like the full board needs to be included in those conversations.
Okay.
So similar to the other regulations, there were model regulations on these. And what I did was I took those model regulations, compared them to ours, and made the changes in there, and that's what you see in the red line version. As with the other regulations as well, these amendments are necessary to be in line with the state regulations. And we met on July 6th, and we talked about the local decisions. So the amendments that are of consistency with the state regulations in these regulations are mainly Section 3, which is the updates to the definitions to be consistent with the state regulations, and Section 4, smoking prohibited, which prohibits the use of electronic nicotine delivery systems wherever smoking is prohibited, which was not in our current regulations. So with regards to the local Board of Health decisions, mainly it's entirely in Section 4.3, where smoking is prohibited. So there's several areas that we discussed. The first one is Section 4.3D, buffer zones around municipal building entrances. So the subcommittee recommendation on this was they had no position, and they wanted to bring it before the full board for discussion. Also, municipal-owned parks and playgrounds, no position to bring before the board for discussion. Municipal-owned athletic fields, the recommendation on that was no position to bring before the board for discussion. So we've got the buffer zones around a municipal building, municipal-owned parks and playgrounds, and municipal-owned athletic fields for full discussion. And then the other areas were membership associations, private clubs. The subcommittee recommendation on that was not recommended, to not include that. Nursing homes, we have none in Burlington. Hotels, motels, B&B rooms, the subcommittee recommendation on that was it was not recommended. The outdoor restaurant bar locations, subcommittee recommendation was not recommended. And public transportation, bus and taxi waiting areas, not recommended. So those were the areas not recommended: membership associations, hotels, motels, B&B rooms, outdoor restaurant bar locations, public transportation, bus and taxi waiting areas. And I suppose the subcommittee can discuss more on, how they came to that conclusion, if they would like, on those areas as well.
Let's take them one at a time.
Okay.
First would be.
So the first would be the buffer zone around municipal building entrances. And I think if, Marlene might be able to weigh in on this as well with regards to her experience in the past in enforcing these regulations.
So if you set a buffer zone, you have to consider where the person's going to be from that distance. So for example, if it's 25 feet from the front door, they smack in the middle of a parking lot. You know what I mean? The other option is that they could set up a smoking area. You know, who's gonna maintain that? Is there gonna be cigarette debris all over the place in those areas? So that's been my experience with the buffer zones.
And I did talk to the town administrator on this, because the way the regulations are written, it would be the owner of the property who is required to enforce it. So if we got a complaint, or the building, if we got a complaint that somebody was smoking, 10 feet from the property when the buffer zone was 25 feet, we wouldn't go out there and say to that person, hey, you gotta move. We would go to the owner of the property, which is the town administrator, and tell him, somebody was smoking here. So I did bring this up with him, and he said, he would go along with whatever the Board of Health feels is correct and chooses. He would send out notices to town employees, but his thoughts on it were that it would be a very difficult thing to enforce.
So, Mr. Chair, I think when we spoke in depth at the subcommittee meeting, personally, I'm not a smoker, right? And we could sit here and say easily, we don't want smoking anywhere in the town of Burlington, right? But there's a lot to go into that decision. There's a lot of folks, other than the Board of Health, that would have to be responsible for managing, enforcing it, and how do you enforce it? Marlene brings up a good point about, it's 25 feet, one's if they're 24 feet, or the 25 feet puts them in the middle of a highway, right, or road. Like, there's so many what ifs that it would be almost, and this is true actually for, open spaces and parks as well, right, which I know we're gonna talk about next, but, logistics makes it almost difficult. But that being said, I think sitting here as the Board of Health, it's easy to say we don't want smoking around or within a certain number of feet, but it's how do you manage it, how do you enforce it? Each building has its own, kind of unique circumstances. How do you go from building to building to say what's right and what's not right?
Okay, I understand. Any questions or? Any comments? You were on the committee.
I think you pretty much summed it up, because it's very difficult to start,
Okay.
enforcing and managing, and then putting that on other establishments to enforce.
I've known Marlene for 20 years. Do you agree? She says also.
So Susan, and I think you did a good job in the subcommittee of talking about what happens today, because I know there were some folks in town hall or in your building that smoke. Like, how does it? It's just outside the door, right? Is that what they do? Is there designated areas?
So right now, they cannot smoke so that the smoke goes back into the building.
That's right.
So if they're standing right at the door and now the smoke is coming back in the building, they would be in violation of these regulations, regardless of whether or not, if they were 10 feet from the door, 25 feet from the door, doesn't matter. If it's coming back in the building, it's a violation. So, so that's the way it currently is now.
Thank you. Now, the second, do we have to, we're not gonna vote on these.
No, I think, as long as everybody's in agreement, or if somebody wants to talk more about it.
Yeah, I guess you have to decide whether or not you want to keep it in or take it out. Yeah. And then the municipal-owned parks and playgrounds, which also goes along with the municipal-owned athletic fields. Most of those are under the purview of the Parks and Recreation. So I did speak to Brendan Egan, the Director of Parks and Recreation. He provided an email, which is in your board book materials. And if you want to, I don't know if you want me to read it or,
Yeah,
okay.
please.
Just bring it up here. So he says, after reading through section 4, I think it would be very difficult for the staff to attempt to keep the parks and athletic fields smoke-free. We do not receive complaints about this now, and I'd like to believe it's because it's not a problem. Adding these provisions and asking town staff to enforce this would be time-consuming and could lead to unnecessary confrontations. we could be chasing calls around town instead of performing the duties of their job. Please let me know if you have any.
Sounds like our COVID discussions. So, Mr. Chair, on this one, you know, I think everybody, and I agree probably with the sentiments from the recreation. I think where we talked about this was, you know, we find it hard to believe that somebody's sitting in the stands at a Little League game and they're smoking away with all these people around them. I'm assuming it could happen. You know, personally, I haven't seen it, or somebody sitting on the common, I guess, could be smoking. Like, it would be hard to enforce. I would recommend that maybe we, as a board, although it might be better remain silent on it, but I would recommend that maybe we have sort of a, you know, an advisory against it as part of that regulation or recommendation to not smoke in parks. But we, you know, I would like to keep it out from the regulation. It just would be another nightmare to manage.
You feel the same way? I agree, Tom. Okay. Next would be?
And then the membership associations, private clubs was not recommended by the subcommittee.
So they'll be like the American Legion if they're smoking down in their club. I mean,
It's their own club.
yeah.
And Marlene may be able to add a comment to that because she's inspected the clubs.
There's a lot of smoking that goes on in
It
there.
certainly is, yeah.
But they are members, they know,
Right.
you know, they go in there knowing what the environment is going to be. And when there is a public event, then there is no smoking at those public events.
Okay.
It's indoors.
Does the regulation say that if it's open, if the event's open to the public, like there's no smoking at those events?
I know it did at one time.
Yeah.
The state law provides very strict requirements for smoking in private clubs. The club members are not supposed to be smoking in the public areas in any event. They're
Right.
supposed to be smoking behind self-closing doors.
Yep.
And I would also just add for the places outside, I think that your sentiment that it seems to not be as big of a problem as it was 10 years ago. Signage is really helpful, even if it's just an advisory. Please consider not smoking on public fields. That goes a long way. And what we found in the municipalities that have prohibited smoking in these areas, that it is pretty much self-enforcing.
Right.
And again, we're about compliance, not about punishment.
Right.
No one's there to give out fines. You just want areas where kids are to be as smoke-free as possible. And I would also add on athletic fields, if there's a school-sponsored event on an athletic field, by state law, that event, like a football game, would have to be smoke-free. That's already in the state law.
Could we
So we
actually
actually
ask the
passed-
park department to put up some advisory signs at some point?
I could certainly ask him.
Would that be?
Yeah, I think it's a great idea.
Have them,
I mean, I don't know who would have to pay for those. I don't know if we have any budget to.
Well, if they're signs pursuant to the school events, the Department of Public Health has free signs that you can use for those.
we could look at that.
Sure, we
school
can see if we can find some kind of signage.
Advisory, okay.
Right.
Do we advise?
That's great.
I would if you wouldn't mind doing that.
I mean, it would say something along the lines, I would imagine, because if you don't put it as a requirement in the regulation, it can't say no smoking. It would have to say, please do not smoke,
Right,
or something like
As a
that.
courtesy, please don't smoke. or
Yeah, yeah.
And see if the Parks Department will do it, even if they
Okay.
put it in the next budget. Thank you. Okay, the next, oh, she's writing.
Okay, the next one is hotels, motels, and B&B rooms. And there was a discussion at the subcommittee about this, and I think that discussion
I'm
centered
sorry, I missed
around
that. I was having.
the hotels and motels.
Oh, right, yeah.
That a lot of the times these hotels, motels have smoking rooms, and that the subcommittee didn't really see any need to ban smoking on the entire property.
Again, there's no smoking allowed anyways in public
areas.
spaces.
Yeah.
Just in the rooms.
And then outdoor restaurant bar locations. Trying to think of, we did discuss this at the subcommittee. I think the discussion's centered around, the restaurants are enforcing this anyways, and we've never gotten any complaints or,
Most, even though it's not enforceable in our regulations, a lot of the restaurants that have outdoor seating don't allow it.
Allow it anyway.
Right.
Okay, thank you.
and then, public transportation, bus and taxi waiting areas, that again, that was not recommended.
I have no problem just waiting.
Yeah.
Any other comments from the board? I mean, I want to, Marlene, you're a senior member here. Do you agree with all these?
Yeah, I reviewed these. I think they look good.
Thank you. Our associate director, how do you feel?
They all make sense to me.
Susan?
Yeah, I mean, I think that my recommendation on the ones that I agree with the subcommittee, and then the ones that there was no position on the buffer zones, I don't think we need that, and I don't think we need the municipal-owned parks and the municipal-owned athletic fields. I think that, I like the idea of the advisory sign, and Brendan, again, has not seen it to be an issue in these areas.
Completely neutral person here. Eric, do you have any comments?
No, I don't.
Do you agree, Eric?
Yeah.
He agrees.
Make sure you put that in the meeting notes. Put that in the meeting notes.
Please put that in the meeting notes that the recording secretary asked for his opinion and provided. Agree with it. You've been here 4 or 5 meetings now, correct?
Yeah.
You're highly educated. We can ask you questions now. As a neutral person, thank you. Our attorney, Sabaro, is that how you pronounce it?
Sabaro.
Sabaro. Are you in agreement with?
This is totally a Board of Health decision. Whatever you decide is right.
Thank you. So I need a motion to actually make no changes, is that correct?
Well, it would be to remove, remove buffer zones around municipal buildings, because I included them in your copy. So remove those items from the copy that you have currently.
So you made the first motion, didn't you? Or you know?
A second.
Why don't you make the second?
So I'll make a motion to approve the revised Board of Health regulations prohibiting smoking in workplaces and public places to what was recommended by the subcommittee in exclude, Susan?
Section 4.0, 4.3C through F. And what is in your copy, so that's the municipal, no, I'm sorry, D, E, and F.
D, E,
The
and F.
buffer zones, the municipal-owned parks and playgrounds, and municipal-owned athletic fields.
And add an advisory to,
Posting.
Well, that wouldn't be part of the regulations, but I can certainly do that.
okay,
Yeah.
okay.
All right. So,
To be effective upon publication?
yes,
Yeah, you can either do it that way, or you can pick a date.
publication.
Publication, yeah.
Publication makes
That's my motion.
Okay.
second.
Second by Ms. Gail Demore. Any other discussion by anybody? If not, all in favor?
Aye.
Aye. Opposed? 4-0-0. Thank you very much. All right, wow. Not done this evening. Down to staff reports.
Thank you, Cheryl.
Cheryl, thank you
Yeah,
so much.
thank you for coming in.
Really welcome.
You were very helpful.
Thank you for all your work.
You were very helpful, thank you.
Thank you,
Thank
very
you.
helpful.
Bye-bye.
Aye, thank you. And if there are other individual calls, you're welcome to give my phone number.
Okay.
Okay. Health agent, or staff reports.
Yes, so I just wanted to update the board regarding the FDA retail program standards. As you recall, I did a brief presentation a few months ago that there are 9 standards and that we chose 3 of them to complete. And standard 1 we have completed, and we had that sent to our verification auditor, who gave us thumbs up. So that is checked off, done, out of the way.
Which one was that?
This had to do with the comparison of our current food code regulations with the most current FDA food code, which is 2017. So we're comparing 2013 to 2017. So we are in compliance. And we finished Standard 3, which has to do with inspection protocols, how we handle variance requests, and HACCP plan reviews. So we've been doing all of this, but we never had anything in writing. So we put it in writing, and Susan was great with the help with that. She really streamlined a lot of the written piece of it. So that's completed, and that is being reviewed by our verification auditor. So once we get the thumbs up from her, that'll be another one we can check off. And we're still working on Standard 3, which is, we have Mike Green helping us with that. It's looking at the inspectors, myself and Samantha, and how we do our inspections. Are we pretty close to doing the inspections the same way? So Mike goes out on inspections with us, observes us, making sure that we are finding the violations that are out there, and that we are consistent when we do our inspections. So he's coming out once a month with each of us, so that's 2 inspections a month. We have to do 6 each. So that'll be done at the end of September.
Wonderful.
Yes. And
Anything else, or?
that's it.
I got a couple, any questions? You all set?
Just actually a comment, so I meant to mention this at I think it was the last board meeting, it might have been 2 board meetings ago, that there's a great little clip on who's working in Burlington, where Marlene was highlighted, so if you get a chance, or you haven't had a chance to watch it, it's an excellent short snippet, and proud member of the staff and the Board of Health, so I just wanted to call that out there.
Any questions? Marlene, how long have you been as,
I believe 18 years.
18 years?
Yeah.
18 years?
Wow.
But 20, actually, probably 26, 27 overall, because I
But
worked
18
for
years.
Boston Inspectional Services and the city of Woburn.
Ah, you were a consultant before.
Yeah.
Oh, I didn't know that.
Yes,
Like, oh, wow, that's
yes,
awesome.
that's where I started in Boston.
Yeah. Huh.
Don't go anywhere.
Yeah.
I learned a lot, I will say that. Excellent training program, and you saw everything.
I'm sure you did.
I have a question about one of your memos about complementary pH kits. Do you give those out, or?
Yes, so that was part of the grant. So we had some money to spend, so we thought it would be beneficial for those who have sushi operations to give them a test kit. It's a strip versus the pH meter. So that way, it's a backup. So if their pH meter, they run out of batteries, or somebody drops it, it breaks, they have something in their drawer that they can pull out and be able to test their rice. So I made a memo so that we were giving it to them, so they understand why we're giving them a pH kit, and it's kind of a one-time deal.
Okay. And the second had to do with, I'm not sure you're the person, because we have a number of reports, is there anything about suspending a permit in town? You part of that, or was that?
Which food establishment, is that
That was the
the one, the hotel?
No, was it 85 Wilmington Road, Dunkin' Donuts?
That's gonna be coming up,
That's gonna be
the
coming.
next board meeting.
Now, are they still in operation at this point in time?
So it is for the local regulations. It's a violation of a local regulation. It's not an imminent hazard. There's no reason not to allow them to continue to operate. However, we feel, and we made a policy around this, because we feel that the board needs to know when these things happen. This is a second violation in a 2-year period. So this is an establishment that we inspect once a year. So we were there last year and this happened. We were again this year and it happened again. So we want to bring them to the board, to notify the board, and to begin the process of what do we do in the event that this continues. So it's not anything that we need to, be alarmed about at this point, but we do want to bring it to the board's attention. This is happening a lot because these establishments have quick turnover, and they have to train people, and there's not enough people working in them, so you could probably expect you're gonna see this more often. If it's something that the board doesn't want to see, we could revise our internal policy to say we're not going to bring them before the board. But it's an effort to kind of enforce our local regulations with more than just a $50 fine, because that's what they get now when they don't have a certified food protection manager on site when we get there.
We are an international community. People come here from all over the world to Burlington. And I think that, I've said it many times, and I've heard other people say it, I want to make sure that anybody can eat anywhere in this community. And having a certified individual there ensures that the food is appropriate. And that's why we put it into.
Right, and I just want to mention too that the state regulations requires that. You have to have at least one person who's a certified food protection manager. So they have that, and they train everybody. The Board of Health's regulations go a little bit more in depth. So you're requiring to have a certified food protection manager from open until close.
And it's not hard to get one,
It can be expensive if they have a high turnover.
because they have to take the course.
And I think we had one food establishment years ago, it was an ice cream facility that requested a variance,
I
if you
remember that,
recall,
yeah.
right? And,
So we have, I'm actually in agreement with you on this. I'm usually in agreement with everything, but, that you bring up, but, you know, we, I believe, you know, are a first-class, community. We are a community that has first-class establishments because of the policies and the rigor that we put around, how we operate, in town. But that being said, I know that it's a struggle today because of getting help is hard to find. But unfortunately, you know, every industry has hurdles they have to overcome, and certainly we can work with establishments. But I think we have the policy in place for a reason. We should be enforcing it.
Even if we set up and bring a consultant in, and I'm not sure if we can do this.
So when we have this at the next meeting, we're going to provide you with your alternatives under the regulations, what you
When I'm
what you
thinking
can
of
do.
training, is there a training center for this food safety manager?
so,
I know you can do it online, I know
you can't do it
You
well,
can't do
you
it
can't really do it online. You can take the course online.
That's what I mean.
To take the exam, you have to have a proctor. And I don't know if Susan mentioned to the board that I'm actually looking to become a certified trainer and a certified proctor. So I want to be able to offer the class at least twice a year to employees that
I
work
think that's
in Burlington.
That's a
We
great
want to
idea.
target the restaurants that we have the issues with. Now, I want to mention that a lot of the big chains, you know, the full-service restaurants, we don't have these issues. It seems to be like the coffee shops that have the constant turnover. And the woman came in today from 85 Wilmington Road, and she was just promoted to this position, and so she'll talk to you at the next meeting. But she has a plan in place that she's going to make sure that she has full coverage, and she's already sent people to the
Well,
course.
that's what we want to hear.
And the other thing, because I'm able to become a certified trainer and proctor, so can't some of these folks. And I talked to her about that, and she said that their company, they have, I think she said 19 stores, and so they have somebody on staff now that's able to train and be a proctor. So there should be no excuse for
How long
this
is the course?
establishment. It's 8 hours. So I'm going to do it over a 2-week period, 4 hours on a Wednesday evening, and then the following Wednesday for the exam. So that's how I'm planning to do it. So usually it's 8 hours.
Marlene, does that mean that somebody from, let's just say they open at 6:30 in the morning, they stay open till 10 at night. Does that mean somebody has to be there all those hours, 7
Not-
days a week?
Not that individual, but just coverage. So there might be 2 or 3 shifts. So that means that the people who work in those shifts need to be a certified food protection manager. So you might have 5 people in the whole store that are certified food protection managers, and their schedule may overlap, or they would, you know, work the shifts so that they would be the certified food protection manager. So, and a lot of restaurants, they have management, you know, they have an opening manager and a closing manager. And so that's part of their training, a lot of these big restaurants, that the manager has to be a certified food protection manager. That's part of their training. They can't even be working.
Well, I would see they might have more of the resources. I can see why it could
Correct.
potentially be a problem in a, a smaller organization
Right.
like that.
Right.
I understand this organization is a multi-million-dollar organization, that.
The parent company might
parent
be, but it
company.
doesn't
And
necessarily
the parent
mean.
company should be held to task then.
I just wanted to understand the ramifications of the vote and the discussion, because the obligation is significant, and unless you have enough staff to cover that many hours in a small organization, even though you might have, the parent company behind you, I just wanted to make sure I understood personally what that
Mr.
obligation
Chairman,
meant.
I would just caution too that we have this discussion at the next meeting.
Yes, that's it.
Yeah.
That's good. Thank you. Let's move on to, first, any other questions for? Okay, if there are any other, can I have a motion to approve?
So moved.
Mr. McSweeney, second by?
Second?
Second by Andrea Sheehan. All in favor?
Aye.
Aye, 4-0. And environmental engineer, do we have any questions for her?
I just had a couple of highlights, if I could.
Please.
The next Household Hazardous Waste Day is on September 17th. Regular time, regular place, Francis Wyman School, 8:30 to noon. Standard operating procedures. So that, again, that's September 17th,
It's usually
2022.
in October, isn't it?
Huh?
Didn't we usually do it in October?
No, it's usually
it's
like
late
mid to
September.
late September. I think once
Oh,
we
like
had
it.
it in October, yeah.
Yeah.
I am, however, I took some board members offered some recommendations from feedback they had from this past spring's event, that it was a little too early for people, because it didn't give them a chance to do their spring cleaning, if you will. So we're actually pushing the spring event for 2023 back almost 2 months. So that'll give people plenty of time to get their spring cleaning done. And I anticipate probably in a little bit of, increase in turnout as well. And hopefully it won't be cold on the first weekend in June like it was this past spring.
Thank you. Outstanding.
The other update I just wanted to give was on mosquito activity and control. Mosquito activity has been very low thus far this season. There have only been 3 positive mosquitoes for West Nile virus detected anywhere in the state, and there have been none detected in Middlesex County, and statewide there have been no EEE positive mosquitoes sampled as of this past Saturday. So because of that, the risk levels for Burlington remain low for West Nile virus and remote for EEE, and those are the 2 lowest categories we could be at right now. So that's kind of good news for this season, and hopefully it doesn't pick up too much. With that, I'll take any other questions on my report.
Any questions?
I'm good, Mr. Chair.
I want to thank you, as I do every year. You put together an annual report for the 3 major contamination areas still in town, and one of which is Cambridge Street.
Yep,
And that is, the thorn in my side, because
I know.
that's the one we can't clean up because the state won't let us. We'd love to dig up that portion of Cambridge Street with the thousands of gallons of released gasoline.
There was actually some improvement in that site, which I didn't reflect in this report because it's technically not, it's technically not part of the RTN, but when they moved it, or changed the operation from an auto repair center to the Valvoline Instant Oil Change Facility, they excavated a lot of on-site soil at 118 Cambridge Street. So that should, and Exxon participated in that, so that should further enhance cleanup. And I think you'll see that in, future monitoring reports across the street, where where the monitoring takes place.
This is a site where tens of thousands of gasolines were released, and it's in the middle of Cambridge Street. I feel that we should take a week and dig up Cambridge Street and get it all done, but the state will let us. It's a state road. Thank you very much.
Sure.
That's great.
And ORC works.
It's seems to be working. They keep,
Oxygen releasing compound.
yeah, they keep digging, taking out the socks and replacing them with new socks that are loaded with the OCR, and the numbers keep gradually decreasing, but, it's a slow, steady process.
Thank you.
Yeah, and I should add that the reason why there's two reports in here for the former Bellafram and high voltage sites is because one is a long existing release site from operations of both high voltage and Bellafram dating back to the 50s, 60s, and into the 70s. The other one, the most recent one from June, is because of the new PFAS regulations under the MCP. Such sites with potential for PFAS contamination are required to go back and start sampling for that and report on the findings. So we may be seeing that for additional sites that were close to being closed, or the original chlorinated solvent plume is tiny or is almost non-existent compared to what it was 20 or 30 years ago, but now it's coming back into the fold because they're finding PFAS, and sometimes that PFAS will mimic the chlorinated solvent plume, but other times it will be in those same areas, but also in other areas just because of the ubiquitous nature of PFAS use in the past. So places that may have had an on-site disposal or septic system that converted to town sewer 20 or 30 years ago, they may be finding PFAS from that because PFAS were in consumer products and still are in some. So we'll be seeing more of those sort of having a PFAS reawakening, if you will. I just got one in. That will be in my next report for the former RCA facility over on Network Drive.
Oh, wow.
And that plume is, it used to cover, the chlorinated solvent plume used to cover everything from where, the Network Drive buildings are now, all the way across the street and to underneath, like, the DCU bank. And now it's this tiny little thing, like, that's under nothing, and it's really, really deep. But now they found PFAS in a lot of the monitoring wells. So I don't know where DEP will be going with, what these sites have to do.
And unfortunately, those just we happen to be monitoring could be everywhere.
Yeah, that's
Could be everywhere where
yeah,
we don't monitor.
that's correct.
I mentioned ORC, and there are new members of the board. Would you maybe it would be better for you to go and just explain what ORC is?
So typically, what they do is they try to intercept a contamination plume, and if you will, a plume is just an underground reservoir of contamination that usually flows with groundwater in a confined, oval, if you will. And so over time, it contaminates both the groundwater and can contaminate sediment around the groundwater. And what they try to do is intersect the plume at its cutting edge, and they put like a trench or a series of wells in that they drill, and they place these socks. Literally, they're like these long socks that contain oxygen-releasing compounds that are designed to react with the contaminants of concern. So in the case of the 118 Cambridge Street, we're talking about gasoline that oxidizes, some of the gasoline compounds oxidize fairly easily and will convert to other materials that are less toxic and basically inert, and help just enhance the natural breakdown that would occur over time. But natural breakdown can take 30, 40 years. So ORC will sometimes speed that up by 10 or 15 years.
Thank you
That's
very
it
much.
in a nutshell.
Potassium permanganate type materials.
Yeah.
We learned something.
Thank you.
Yep.
Do we have a motion to approve, unless there's any other questions? I don't think so. Motion to approve the environmental engineers report.
Motion to approve.
Motion by Andrea Sheehan, second by
A second.
Gail Demore. All in favor?
Aye.
Aye, 4-0. Associate Director of Public Health. Do we have any questions for? Do you have anything to highlight?
Yeah, I would like to just point out we're shifting our online permitting from civic engagement to Viewpoint. We've been working with our administrative staff, and we're coming on, well, we're building a bunch of our forms and permits behind the scenes. Hopefully we'll be coming online, front-facing customer side shortly. But this is also the system that building and planning uses, so getting in line with the rest of town.
Will they be able to pay online?
Yeah, absolutely. Yep, that's part of it. They'll be able to renew all of our permitting. Hopefully we'll shift to this and hopefully make it a lot easier for them as customers to come in and apply, and easier for us to manage the workflow both digitally. If they submit an application, doesn't have everything we need, we can kick it back to them to get what we need before we move on to the next steps.
Interesting. Any other questions?
The FBI investigation on Maven, what was that about?
That was just a foodborne illness complaint that we received through Maven. After follow-up with the complaint, given the symptoms, onset, incubation time, it didn't seem like it was the establishment they thought it might have been here. But after talking with them, they had eaten at several other establishments across the country, actually, that may have fit better with the symptoms they had and the incubation they were dealing with.
Thank you for that. This might be more of a question for you, but I noticed you mentioned in your report the cafe schedule self-assessment, but just wanted to comment, we had, since they've moved off of that stuff that dripped in the sink, what was that?
Oh, yeah, oh, jeez. I can't, protein matrix? Is that-
Yeah, that's it.
For the drain.
Yeah, the
Grease traps.
grease traps.
Yeah.
Have we?
We haven't had any, DPW has not notified me that there's
That they
been
cleaned
any
out the sewer
problems
and-
there.
Yeah, that's great.
Recently, I haven't gotten any notifications around that from them, and I'm sure they would call us.
Yeah, they definitely would have.
Yeah,
Yeah.
They've abandoned that protein
Yes.
matrix.
I believe so.
Yeah, they did.
They
Yeah.
abandoned
I think it was 2 years.
Well,
ago.
I think the agreement was that they were gonna continue to clean
Oh,
out,
that's right.
but they were gonna use it
Use it.
still, but they were gonna still adhere to what we required, which was the clean outs. They were trying to do it,
Without
not
the-
doing the clean outs, and that just didn't work.
Interesting.
Thank you. Thanks, Mike.
Anything, Gail? Or? Well, I have one. Congratulations. 2 weeks ago, you spent the full week allowing our director to go on vacation. And our associate director was in charge of the office for a whole week. And I checked in one day just to say hello, and it was still there. So thank you so much. It was great. And thank you for doing everything you do. Motion to approve the Associate Director of Public Health report
So moved.
by Mr. McSweeney, second by Ms. Sheehan. All in favor?
Aye.
4-0. And last, the Director of Public Health, which includes the Associate Health Inspector, which is Samantha Hardy, and the Supervisory Nurse, Christine Pollock, and then her own. So I'll go back in order. We'll take the vote at the end. Does anybody have any questions about the Associate Health Inspector's report? No, we'll go on to the Supervisory Nurse. We have something from the Supervisory Nurse report.
Are we all set with flu vaccine orders and all that stuff coming in?
Yeah, so we put our order in.
I remember, yeah.
And it usually gets shipped around the beginning of September. It starts coming in. So I can expect that it'll start coming in around that time. We get so much in September, so much in October. shortly, in August is when I start planning the flu clinic.
We haven't set a date yet.
Haven't set a date yet. I have to be in touch with Wayne. That's what I usually do, make sure
Right.
he's gonna be around.
Right.
And usually he likes to have it more towards the end of October, because he thinks people shouldn't get it too early in the season. So I'm expecting that'll be the same, and that we'll do it around the end of October.
Thank you.
I have one question and one, I'll wait to yours. We are contact tracing monkeypox now, is that correct?
Yeah, so we had a webinar today with Department of Public Health on monkeypox. They went over the symptoms, currently what we know right now, the vaccine, how the Board of Health is going to do the case investigation and the contact tracing for it. It all goes through Maven, like we do all of our communicable disease. There's a question package that we would go through with the person, if there's a confirmed case. And then there's also a way to identify close contacts of that case. So, yeah, we did have one contact, which was really odd because it really wasn't a close contact. I don't know why it was somebody on a plane with somebody who had it. So, but in order to transmit monkeypox, you have to be in really close contact with someone who has the lesions, or is symptomatic. And the symptoms can start first, and then you get the lesions or the rash. So, to me, that was not really a close contact but we did call, and the nurse called and followed up with the person and just let them know. But it's not like COVID, it's not transmissible through the air type of thing, 6 feet distance, you have to be in really close contact.
And we're not getting any vaccines?
So the vaccines are, right now, there's a limited supply of vaccine. So there is an ability for people to get vaccinated if you fall into a high susceptibility category, and that's gonna be determined by your provider or DPH. And there are some sites that you could go to get vaccinated if you fall into that, or if you've been exposed. If you've been exposed, or if you're exhibiting symptoms, if you're exhibiting symptoms and you were around somebody with monkeypox, they're providing the vaccine for that, and they believe that it may work to stave off you getting a full-blown case of monkeypox, or maybe not getting it so bad. So, but that's limited. Vaccine is limited right now.
Christine Pollock put together a terrific presentation, if you saw it, for the rec department. She's also put together a tremendous amount of presentations on behalf of the Board of Health. This week, I asked her to please provide us a document which would allow us to use some of those presentations after she retired. And now there was probably no question about the intellectual property, because she did it before, but she was gracious enough to send myself and Susan a document. So if you ever need any of that material, and then you saw how good it was,
Yeah.
She has provided us unlimited usage anytime. And I just wanted to congratulate her and thank her for that. And we'll miss her. I guess we will soon begin interviews next month.
August 10th, I
August 10th.
believe, yeah.
We'll begin interviews, and so let's move on for that. And now, any questions for Susan Luminello, our Director of Public Health? I have none. She's answered them all.
One thing to add is we still have COVID test kits, so members of the public can come to the Board of Health office and pick up the test kits. Chris Pollock has also been giving them out. She gave them out some to the rec department. She's been going to the food pantry to give them out. We're also gonna be at Celebrate Burlington on August 6th, and our volunteers will be giving them out there.
So if you need some, please come and pick them up. With that, could I have a motion, please, to approve the Director of Public Health, which also include the supervisory nurse and the associate health inspector.
I'll motion it.
Motion Andrew Sheehan, second by?
I'll second.
Second by Gal Demore, all in favor? Aye. Well, that brings us to a close this evening. Please enjoy the summer. Please stay cool. We do have some days which have been announced that the senior center has a cooling area, a cooling station. When on very hot days, please, you can check with us or the senior center when we have those facilities open. Be well, be safe. Good night.
Mr. Chair, one thing actually, sorry. Water ban is on, that includes wells in town. It's a full-blown water ban,
Yes.
7 days a week, 24 hours a day.
I've gone around town and I've seen people watering and
Seen sprinklers on?
sprinklers on, and people are complaining about it. And I will tell you that they're getting letters, certified letters from the DPW asking them to cease and desist, and with threatening fines. Please don't call the Board of Health. Please call the Department of Public Works because you're going to make a complaint. But please comply. We're buying 1 million gallons of water per day from Quab and from all of a sudden I can't, the Department of
MWRA.
MWRA, and spraying water, irrigating could use thousands and thousands of gallons. Now, we don't have anything to do with the water in this town. We don't make the water, we don't certify the water, but we are all members of this community. So please, thank you very much, Mr. McSweeney. Do I have a motion to adjourn?
So moved.
Mr. McSweeney, second by?
Second.
Second by Ms. Sheehan, all in favor?
Aye.
Good night, everybody.